Good afternoon, everyone, and thanks for joining us for Pancare Foundation's first Living Well series webinar. My name's Liz, and I'm part of the team here at Pancare, and I'll be your host today. Despite many of the challenges that COVID's thrown our way, we're thrilled that you're here with us, and we're so thankful for the use of technology like this that enables us to provide you this valuable session. And it's all been made possible thanks to funding from the Dry July Foundation. Before we go any further, in the spirit of reconciliation, Pancare acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. If you're new to Pancare, we're a not-for-profit organisation whose sole purpose is to support people living with upper gastrointestinal cancers, such as pancreatic, liver, stomach, oesophageal and biliary cancers. We raise awareness and we help accelerate research for these cancers. No matter if you're a patient living with an upper GI cancer, or you're caring for someone, or you're a health professional working in oncology, we certainly hope that you find something valuable out of today. And in addition to what you'll learn, the key message that we want you to take out of today is that you're not alone. We're here to support you. No matter if you've been recently diagnosed or you're undergoing treatment or you're caring for someone and need to hear the voice of someone who understands, we've got a patient support team who would love nothing more than to support you on your journey. And I'll let you know a little bit more how you can talk to them at the end of today's webinar. So to make today's session as easy as possible for you, we've got a few little tips. On your console on your screen, you'll be able to follow along with our presenter slides on your panel, and you should be able to see a screen now that's got the Pancare logo on it. You can make that screen bigger by dragging on the corners of the box so you can see the presentation in full detail. And at any time, if you've got a question, whether that's a technical one or you've got a question in relation to the content, on the bottom of your screen, you'll also see a Q&A box where you can type your question. And as part of today's webinar, we've got a question and answer time at the end, and we'll do our very best to answer all your questions as we go through. So let's get it all started. So one of the common themes that we hear from patients living with an upper GI cancer is that diet and nutrition is one of the key challenges and concerns. And so today I'd love to introduce you to our presenter, Lauren Atkins. Lauren is a senior oncology dietitian and an advanced accredited practicing dietitian at OnCore Nutrition. She's got over 10 years experience in oncology and has supported many patients living with upper GI cancers, as has a brilliant presentation for you today. So Lauren, I'll hand it over to you to get things started for us. Welcome.
Thank you, and thank you so much for having me. It's a pleasure to be here, and thank you all for joining us virtually online. As we know, strange time to be alive, so feeling really fortunate that Pancare have put the time and effort into bringing this to everybody online. So we're going to talk all things diet and upper GI cancers today. As Liz mentioned, I will leave time at the end to answer any questions that you do have, so feel free to type those along the way, and we'll make sure we leave time at the end to get to as many of those as possible. But before we do start, we've got a quick poll for you all. Now, this is absolutely voluntary, so if you'd rather not answer, that's completely fine. But we do want to get a bit of an idea of what brings you here today. So I'm going to move on to the poll, and what I'll get you to do, if you're feeling comfortable, is to select the response that best corresponds to your situation. Our intention here is that we're going to try and tailor the content and build the journey so that it actually becomes as meaningful as possible for you. So I'll give you a few more minutes just to click through your answers. Appreciate everyone who's already popped in their responses. All right, so for those who have been kind enough to answer, I'm going to share the results of that poll. Essentially, the audience today is predominantly made up of those who are challenged with a pancreatic cancer diagnosis. We've also got a few health professionals in the room and a few with other upper GI cancer malignancies. So that's really helpful for me, will help me to tailor the content. And as mentioned, any questions along the way, feel free to pop them in the chat function or the Q&A function. So what we're going to cover today is nutrition and the upper GI tract, some of the challenges of upper GI cancers and its treatments, how to manage some common symptoms associated with upper GI cancer and treatment, provide you with some practical tips and how to actually put that into action. We'll talk through some alternative diets and complementary therapies, and like I mentioned, plenty of time to have your individual questions answered. So the upper GI tract consists of a range of very, very important organs, starting from the esophagus, including the liver, bile ducts, gallbladder, stomach, and pancreas. Each of these have really valuable, unique functions, both in how our body processes, digests, and absorbs food, but a whole bunch of other hormonal and detoxification processes as well. So if we start at the top with the esophagus, or what's also known as the food pipe, we know that this is a particularly important organ for the passage of food from our mouth into our stomach. And certainly if the esophagus becomes damaged in any way, we know that swallowing can become painful and difficult. There's also a valve or a sphincter that connects the stomach with the esophagus, and this is really important for preventing the backflow of food and acid into our esophagus that can sometimes contribute to reflux if this is an issue. If there's any removal of the esophagus, so in the case of esophageal surgery, what generally happens is the stomach is dragged up and connected to the higher part of the esophagus. And what that often means is you're left with a reduced stomach capacity, and you can end up with some issues around reflux, feeling full really quickly, having a reduced appetite, but also the necessity for a texture modified diet is quite common in the case of any damage to the esophagus. We also know that stents and stretches or dilatations are often used in the management of esophageal cancer. The stomach, as you can imagine, vitally important for the digestion of our food, both chemically in the use of enzymes and gastric acid to help break down the nutrients that we eat, but also mechanically in the churning of the stomach. It's also useful for absorption of some particular nutrients and other elements, particularly things like alcohol and some medications. And the stomach is really important as a holding bay or a reservoir for food and fluid. And so if there's any surgery or change to that capacity of the stomach, there's often less volume for food and fluid, which can contribute quite significantly to some of the symptoms associated with stomach cancer. We know that dumping syndrome is common in the case of stomach cancer, and that's related to the fast passage of food if there is a gastrectomy or a stomach removal. And because of the importance of the stomach in digestion and absorption, if we have damage to the stomach, we can certainly impact the way that we digest and absorb food. The liver is a really important organ for digestion, metabolism, but also for detoxification. And so if there's any damage to the liver, whether it's through malignancy or through associated treatments, we know that we can have alterations to the way that we metabolize our food and also process our wastes. And then we have the pancreas, which is a very important organ for digestion in that it produces the enzymes that are responsible for breaking down and absorbing the food that we eat. The pancreas is also responsible for producing hormones, insulin and glucagon, that are involved in regulating our blood glucose level or our blood sugar levels. So really important for our energy and our storage of nutrients. And so because of these particularly important functions, if there's any damage to pancreatic tissue, this can cause issues with digestion, absorption, but also with maintenance of our blood sugar levels and therefore energy levels. Now, to give this a little bit more background, digestive enzymes are really important for breaking down our macronutrients, so proteins, fats, and carbohydrates. And the way that these work is almost like a cleave or a pair of scissors. So if you can imagine that a protein or a fat is a long necklace or a chain, What the enzymes do is actually helps to cut these long chains into smaller links. And it's the smaller links that can then be absorbed by our digestive system. So if you've got a pancreas that has functioning digestive enzymes, when we eat our food, these long chains or necklaces get cleaved or broken down into smaller links. These links can then pass across the wall of our digestive system, our intestines, and we absorb those nutrients. What this leads to is regular bowel actions because we get rid of a normal amount of waste, but it also contributes to those nutrients being used by the body. So we end up feeling energized, we're fueled, we have a good nutritional status. On the flip side, if there was a malfunctioning pancreas or a lack of digestive enzymes, we can end up with these long chains not being able to be broken down into smaller links. And so the long chains pass unchanged throughout the digestive system, through the small bowel, the large bowel, and they don't get broken down or absorbed. And what this can often lead to is symptoms of malabsorption. Because the long chains don't get absorbed, they actually end up being passed through our system and end up in the toilet bowl, a little bit wasted. And we can end up with symptoms of loose or regular stools. We can end up with weight loss and nutritional deficiencies, malnutrition, but certainly also fatigue and weakness because we're not able to draw the nutrients and the energy from the food that we're working so hard to eat. The pancreas is also really important for blood glucose control. It produces those two hormones, like I mentioned, insulin and glucagon. And if the pancreas is not functioning properly and there's any damage or disruption to the release of insulin and glucagon, we can end up with either high or low blood sugar levels. And some symptoms or signs of low blood sugar levels or hypoglycemia include things like feeling shaky and nervous, a bit anxious, lightheaded or dizzy, and having a fast heart rate. On the flip side, if we end up with high blood sugar levels, we can get things like blurred vision, a need to urinate really often and feeling really thirsty. You can end up with headaches or tiredness, difficulty concentrating, and certainly weight loss, again because of the inability to absorb the sugar that our body's taking into our bloodstream. So the upper GI tract, the organs of the upper GI tract are so vitally important for how we process our food. As we can imagine, through cancer-related treatments, we can cause further damage to those organs in the process of working towards cancer care. Now, the main types of treatment used in upper GI cancer care are radiotherapy, surgery, and chemotherapy, but also targeted therapies, so things like immunotherapy and biological agents that are work in a different way to target the cancer more specifically. And these are becoming more and more common in our cancer care. Now, I've got another quick poll for you related to this. Again, absolutely optional, so it'd be great if you could answer this next question for me to help get a bit of an understanding of which of the following treatments you or your loved one have received or are planned to receive. So if you could all take a couple of minutes just to have a little look through here, and you can select more than one option. All right. Answers are coming in. Thank you, guys. was quite a mix of results with this one. I'm going to share those results with the group in a moment. Give everyone 2 more seconds to plug in their answers if they want to get involved. But what we're seeing is that there is quite a large number of us in the audience have received chemotherapy, and certainly quite a number of radiotherapy. Pancreatic surgery is quite common by the looks of things in the group that we've got today. But there's also quite a number who've had other different surgeries and immunotherapy. So that's really interesting, and certainly each of these treatments have their unique challenges, which I'll touch on, and we can go through some strategies of how to manage those. So when it comes to upper GI surgery, really this is going to depend on the location of your tumour. And the surgery, if we think about the esophagus, surgeries that are quite common in esophageal cancer are an esophagectomy, which is where I described before, where the esophagus is resected and the stomach is then dragged up to meet the top end of the esophagus. And you end up with the stomach forming part of the esophageal food pipe. And you can end up with challenges related to the stomach feeling quite full, reflux, nausea and vomiting. Stents are quite common in esophageal cancers, and that's where we insert a mesh or plastic or other material guide or wire that actually helps to expand or keep open the passage of that food pipe. A dilatation does a similar process but doesn't actually use anything material to keep that passage open. It just stretches it to help allow for more space for the food or fluid to pass through that esophagus. Surgery related to stomach cancer is often in the form of either a total or a partial gastrectomy, where some or all of the stomach is removed. And as I mentioned before, with that stomach being particularly important for being a reservoir and a processing unit for our food, removal of that can significantly impact the way that we digest and absorb our nutrients. In the case of pancreatic cancer, total, partial pancreatectomies are common, as is what's called the Whipple's procedure, which some of you may be familiar with. And these surgeries all present very unique nutritional challenges, which we'll talk through some of those in a little bit. Now, if you're wanting some more information, in particular around the nutritional management after upper GI surgery, we do have a range of guides that are available on the OnCore Nutrition website, and I've made these available for free for anyone here today to download, and they provide some guidance on how to manage nutritionally through these issues. So feel free to take a little photo of that. All you need to do is use the code PANCARE2020 and you'll be able to download these guides as well as a range of others for free. Now, chemotherapy, a lot of you did select or highlight that you either received or plan to receive chemotherapy. Chemotherapy is a little bit different to surgery in that it functions in a different way. It might be given before or after surgery to help shrink or minimize the burden of that tumor to allow surgery to happen, or it might be used alone to help manage the cancer growth or to help control or manage symptoms. And because chemotherapy is what we call systemic, it actually impacts the entire body. The way that chemotherapy works is, in many cases, it targets cells that rapidly divide. Because we know that cancer cells rapidly divide, chemotherapy specifically targets those cells, which is great for cancer control, but it also means that we can end up with side effects for healthy tissue that also naturally rapidly divides. And that includes cells of the lining of our gastrointestinal tract, but also things like our skin and our hair. And so the whole body nature of chemotherapy can make it quite challenging. Side effects of chemotherapy commonly include nausea and vomiting. And if you can imagine, we are introducing a foreign substance directly into your veins or through an oral chemotherapy. And if you can imagine back in the back a long time ago when we were hunters and gatherers, if we ended up with some sort of foreign agent circulating through our bloodstream, the body would assume that we'd eaten that, we'd ingested it. And so nausea and vomiting related to chemo is in many ways quite a natural response to us trying to get rid of this thing that's foreign to our body. It's a natural response. It's quite common, but it by no means should be considered reasonable to have to deal with nausea or vomiting during chemo. There's so many wonderful ways to manage that these days. Taste changes are quite common, related to the damage to the taste buds that can occur through those rapidly dividing cells that are targeted. Mouth ulcers in a similar way, and also digestive issues. So diarrhea and constipation can result from the medications used, but also from that disruption to the lining of our bowel because those cells naturally rapidly divide. Loss of appetite and fatigue are really common with chemo. And although these symptoms are really common, again, it's important that we don't consider them reasonable to deal with. There's lots of management strategies that can make things easier and allow you to continue to be comfortable as best as possible through this. A radiotherapy is a little bit more targeted, and it uses ionizing radiation to damage or destroy cancer cells and is quite targeted to the tumor site. So if you're having radiation to a specific area of the pancreas, your side effects are likely to be localized to that area or to the associated field. Some common side effects depending on the location of the radiation field would be pain or difficulty swallowing, nausea or vomiting, changes in appetite and feeling full quickly, changes to bowel habits and absorption of food, fatigue and malnutrition are quite common. And in the case of pancreatic radiotherapy, blood sugar changes might occur. Now, there are ESPEN guidelines, so some European guidelines for the management of nutrition in cancer patients, does state that all patients receiving radiation to the gastrointestinal tract should receive comprehensive care from an oncology dietitian, ideally from before they've even started. So making sure you're linked in with a dietitian as soon as possible once you're aware of a plan for radiation is really, really important. Now we're going to talk through management of some of these symptoms and side effects, of which I have spoken about plenty, and they can be really debilitating. Now, if we have a think about some of the things that can be impacted by both upper GI cancer itself, but also the associated treatments, they all are very linked to the way that we process our food.
While we're waiting to have that trouble fixed, we noticed that you've got quite a lot of questions coming in, some of them really specific to digestive enzymes like creon dosage and also how we can combat that fatigue. So we're certainly seeing those questions pop in, and we've got that question and answer time set aside at the end of the session here. So we'll certainly get around to how we can respond to some of those questions that you're going, but I certainly know that Lauren's got a lot of that content prepared in her presentation today. Just seeing some notes come in from our system administrator on trying to get Lauren back in. Of course, technology is wonderful when stuff like this happens. It's not ideal, but we'll get her back in a second. If there's any other questions that you do have that you can think of, perhaps while we're waiting to get Lauren back into the presentation, there is that question and answer chat there that you can use. Sarah from the Pancare team is on the other end of those questions that are coming through and feeding them through to me, so we'll be able to get to those shortly. Perhaps while we're still waiting as well, for those of you who don't know a whole lot about Pancare, as I said at the start, we've got a great patient and carer support team who are here to help you on your journey living with an upper GI cancer, or whether you're a carer as well and need some practical advice and support for helping your loved one on their cancer journey. So I'll introduce you to our two support workers at the end. So that is Shannon, who is our upper GI cancer nurse, and also Sonia, who's our patient support manager. And hopefully you've had the chance to speak with them them in the past. Otherwise, I'll let you know some ways that you can get involved and have a chat to them. And although we may not be able to give the medical advice, we can certainly help you with some practical advice on, dealing with the diagnosis, trying to unpack and understand what your surgeon or your oncologist may have told you about different treatments or surgical interventions that you might be able to have, and really help you with some of those symptoms that are on a day-to-day basis that are a challenge that you're trying to deal with. Sonia, who's our patient support manager, can really help you with that practical and emotional side of the cancer journey, to helping you to connect you to others who might also be living with an upper GI cancer, so you can speak with someone else who's walking the same path as you, understand the experiences that they're having. Sonia can also help find some local support services in your area. So whether that might need allied health professionals like a dietitian, like someone like a Lauren, who can help you post-surgery or while you're undergoing chemotherapy. And Sonia also runs our patient support group, which meet monthly as well. So they're a great way for you to kind of come into a safe place. At the moment with COVID, they're all online, so it doesn't matter where you live in Australia. You've certainly got the opportunity to join us online and meet others who are walking in a similar position. They're a great way, very calm environment, really nice and inclusive. Sometimes they are a peer-to-peer one, so it's the opportunity for everyone to talk amongst themselves and unpack some of those day-to-day challenges that you're having, or learn and share ideas on what may have worked as part of your chemotherapy regime, or dealing with some of the side effects. And sometimes we bring in an expert presenter as well, who might talk about aspects like diet, nutrition, or they might talk more about the emotional and mental well-being as well. And I think we might have Lauren back on the call, which means you don't have to listen to me anymore. Do we have Lauren back?
Are we back online?
Hi, Lauren. You're back.
I can't hear anything.
We can hear you and see you.
Okay, you can hear me. That's great.
That's great.
I'm not sure.
Sorry, Lauren, I've just filled everyone in, so we'll let you carry on with the presentation. We'll take you back to it.
Okay, I'm sorry about those tech difficulties. I'm not sure where I got up to, so I might just start this slide fresh, and any questions, please send them through. Team, please feel free to chat to me because I actually can't hear anything. So thank you for bearing with us with our tech challenges. Dryness in the mouth is really common with chemotherapy in particular, and artificial salivas can be useful to help lubricate and keep that mouth nice and moist. There's another product called Xylee Melts that actually helps to generate your own saliva flow if you do have some functioning saliva. That are out there. And quite soft foods are helpful to help make sure that you're comfortable with your dry mouth. Now, when it comes to taste, our taste buds can be affected, particularly when it comes to chemotherapy that damages our taste buds. And there's really no one size fits all when it comes to taste. And the most important thing is a bit of trial and error. Now, in particular, if you've got challenges with your mouth tasting metallic or food tasting metallic, a switch to plastic or wooden cutlery can sometimes help. Keeping your mouth really clean and fresh before you eat is important, and experimenting with different flavors, herbs, spices can be useful, as well as different textures, because we get a lot of sensory feedback from our food, not just with relation to taste, but also with crunch and different textures and temperatures too. When we have radiation or chemotherapy, we can end up with painful swallowing or mouth ulcers, and soft, moist, or even pureed foods can sometimes be recommended to make sure that we're not causing any trauma to that already inflamed and painful mouth and throat. Nourishing fluids can also be really helpful to make sure you're meeting your nutritional needs if you're struggling with pain in your mouth or your throat. Medications are also really important if you're in pain when it comes to swallowing or with your mouth. and they can help to actually cover you at least for a mealtime, so you feel like you can manage your food and fluids enough to get some nutritional content in. And as with nausea, it shouldn't be an expectation that you have to just manage with pain. This is generally really well controlled so long as you're speaking with your medical team about it. Reflux can be quite common, particularly if there's any damage to the esophagus or the stomach, or if there's surgery that's removed the sphincter or the valve that connects the esophagus to the stomach. And anti-reflux medication can be particularly important. But we can change our diet to help manage as well by avoiding acidic, spicy, or really greasy or fried foods, but also positioning ourselves. So remaining upright for about 30 minutes after we eat and avoiding overfilling the stomach as well. Nausea and vomiting are very common, and as I mentioned, it shouldn't be an expectation that you just have to manage that. Anti-nausea and anti-emetic medications are frequently prescribed, and they all work in somewhat different ways, so it's quite important to understand how they work. Metoclopramide or Maxilon or Primin, for example, works by actually relaxing the valve at the bottom of your stomach to allow food to pass through. It works best if you take it about 20 minutes to half an hour before you eat. Other medications, so ondansetron or Zofran, it's less important what time or the timing that you take them compared to your food. So understanding your medications is really key when it comes to nausea and vomiting. Some people find that avoiding food smells can be helpful, and so choosing foods that are cold or at room temperature can be less off-putting than those that are warm and come with a fragrance. And small, frequent meals, rather than relying on large meals, can help in the case of nausea and vomiting as well. Dumping syndrome is a condition that can result where there's been stomach surgery or in some cases Whipple's procedures, and it's related to the fast transit of food from our stomach straight into our intestines, where normally it would sit in our stomach and be processed for a little while. You can end up with some symptoms of blood related to your blood sugar control. So you can end up with shakiness, nervousness, but also changes in your bowel habits. So if you're someone who's had any surgery to your stomach or a Whipple's procedure, it's important to ask your medical team if you're at risk of dumping syndrome and seeking support from a dietitian if this is the case. Nutrient malabsorption is really common in the case of certainly surgery, but also chemotherapy or radiotherapy where there's damage to the stomach, the intestines, where we're less able to absorb our food and fluids. This can result in malnutrition in the form of insufficient energy or protein, but can also result in micronutrient deficiencies of things like iron, calcium, B12, and fat-soluble vitamins is very common. Now, as I mentioned before, when we think about the pancreas and the importance of breaking down our food into units that can actually be well absorbed, it's important not only for our macronutrients, our proteins, our fats, and our carbohydrates, but it's also really important for the vitamins that come along with them. So our fat-soluble vitamins can often become low or depleted if we're having trouble absorbing our food and our fats in particular. We can end up with changes to our fluid status and also with our bowel habits. So constipation is quite common and associated with chemotherapy. And in the case of constipation, normally we would provide advice on things like fiber and fluid intake to make sure that you're getting enough to keep your system moving. But if constipation is medically caused, generally it needs to be medically managed. And the use of laxatives or aperients is really important to help keep you regular and keep your food passing through the system. In the case of diarrhea, this can certainly be a symptom or a sign of malabsorption of fats in particular, particularly if you're someone who's challenged with pancreatic cancer, but can also be related to damage to the intestinal lining. And so anyone who's having chemotherapy can experience diarrhea, and changes to the types of fibre that we eat can help in managing this, as well as particular carbohydrates that ferment in our gut. So if you're someone who's struggling with diarrhea, again, shouldn't be an expectation, and it can be managed. So making sure you're seeking support. And I'm happy to answer any particular questions that you have about your bowels and your gut at the end of this session. Now, one last poll for you all. And again, if you feel comfortable answering, we'd love to get your responses here. And I'll give you a couple of minutes to answer, how would you describe your body weight? Again, completely optional. So if you don't feel comfortable, you're welcome just to leave it blank. But I'm wanting to get an idea here of how people are managing in terms of whether their weight's going up, going down, or if it's not so relevant. Okay. So aside from our health professionals, the majority of the audience, just marginally, are struggling with weight loss. And that's not much of a surprise given the cohort of people that we have here and the impact of upper GI cancers on our ability to absorb nutrients. And given that long list of side effects that I described, this can make eating and drinking really challenging, and the risk of malnutrition and weight loss quite high. Now, how to best manage this situation is to help make sure that you're meeting your nutritional needs, which, like I mentioned, can be really challenging. And so we like to break it down into 3 steps to help make sure that you're meeting both your energy and your protein needs throughout your treatment. Because it's one thing to meet your caloric requirements, your energy needs, but more importantly, we want to make sure that you're preserving your lean body mass or your muscle mass, which is your strength, because this is important not just in terms of tolerating the treatment, but also in the case of your strength and your functional capacity and your ability to recover and be well long-term after your cancer treatment. So the 3 steps we're going to talk through are around protein, fats, and carbohydrates. It can also be a good idea to keep an eye on your weight. Weekly is plenty, but just to keep track of what the trend is, whether things are tracking upwards or downwards, and you can be aware of any concerns that come along. So step 1 is to build your meals around a protein source. Now, whether they come from plant or animal sources, we want to make sure that we're getting plenty of protein in to help preserve that lean body mass. And we know that it's very important to help prevent and manage malnutrition. So some good sources of proteins listed here, whether they come from animals or plants, both have their place. And if you're someone who is interested or is requiring protein supplements, making sure you're speaking to your dietitian about the most appropriate one for you. And we'll talk more about them in a moment. Step 2 is to add fats and oils. Now, ideally, we want to focus on what we call omega-3 polyunsaturated or monounsaturated fats and oils, because we know that they're really health promoting and anti-inflammatory in the body. So extra virgin olive oil is a really good place to start. Sunflower, flaxseed, sesame and peanut oils are good options as well. Being really liberal with these, but also with things like avocado, nut butters and pastes, nuts and seeds, coconut and butter, olive oil spreads if you're interested. When it comes to fat, and for those of you who may be requiring pancreatic enzyme therapy or Creon, it's really important to know how this Creon works and to match it to your fat intake in particular. And if you're wanting some more information on Creon and Creon use, make sure you download our pancreatic cancer guide that talks through this in a little bit more detail. And very important that you seek support from a dietitian to get advice on the timing and the dosage, because Creon needs to be taken in exactly the right way in order for it to work properly. Certain foods don't require Creon, and they're foods that don't contain any fat or protein. And so fresh, dried or canned fruit, jellies, sorbets, lollies, soft drinks, or tea or coffee with just a splash of milk doesn't require any creon. And step 3 is to focus on including low GI carbohydrates. Now, carbohydrates come from a range of different foods in our food supply, from breads, pasta, fruit, veggies, but also sweet things like lollies, cakes, and biscuits. And understandably, as you can imagine, these are not all equal. And one way that we can help to distinguish or classify different carbohydrates is through the glycemic index. Now, the glycemic index is a measure of how quickly a carbohydrate food is broken down and absorbed into the bloodstream. Now, certain foods are considered high GI, which would be this red line here, and they're broken down really quickly and absorbed quickly into the bloodstream. They give us a rush of energy, and then quite soon after, they leave us feeling quite flat or tired, but also hungry again. If we compare that to a low GI carbohydrate, these provide a more sustained release of energy over a longer period of time, and they keep us feeling satisfied and energized for longer. Now, we all know what that blood sugar low feels like. You might have all experienced this after a big Christmas lunch, perhaps, or a carbohydrate, a very heavy pasta meal, or some lollies. Soon after, you end up in that slump where you're ready to fall asleep. And that's really important to avoid when you're already feeling fatigued during cancer treatment. Now, here's a bit of a guide on some particular foods that would be classified as high GI versus low GI. But for more information and a bit more of a comprehensive guide and a shopping list, I'd encourage you all to download this glycemic index guide from our OnCore store, also free with that code PANCARE2020. So make sure you jump on and grab that, because it can make a big difference to how you feel in terms of your energy levels and the impact that it has on your pancreas across the day. Now, this is something that we hear quite often during cancer treatment, and it's often very, very well-meaning and in many cases reasonable, the advice to eat whatever you feel like. But if you can imagine, when you feel like this, it's quite unlikely that you're going to feel up to doing this and preparing a really healthy meal and eating meals like you normally would. And so what can sometimes be more realistic and more helpful is to actually aim towards having high energy, high protein, and low GI snacks. So smaller, more frequent meals compared to 3 square meals a day. And this is really helpful because what we know is that the more often we eat, the more frequently our body will expect food. And that can actually help to preserve our appetite. So some ideas of things to have that are high energy, high protein, low GI might be things like yogurt, fruit. You might have some falafel or meatballs. You might make some nut or protein balls, some whole grain toast or crackers with dip, or avocado with nut butters, baked beans, boiled eggs, and certainly fluids that provide nutrition. So things like smoothies and protein drinks can be very, very helpful, because sometimes drinking our nutrients is easier than eating them. And that brings me to nutrition support and oral nutritional supplement drinks. You might have heard of some of the commercial varieties, things like Sustagen, Ensure, Fortisip, but also can certainly be made DIY at home with high energy and high protein ingredients. The commercial versions in many cases are what we call nutritionally complete, meaning that you can survive off them, and your dietitian will guide you on the most appropriate supplement for you. But also, if you are taking creon, it's so important that you do take your creon alongside your supplements to make sure you're actually absorbing them. In some cases where you're unable to meet your nutritional needs through food or fluid alone, enteral feeding or tube feeding may be required. And if this is something that's necessary for you, you will be linked in with a dietitian to support you through it. But I'm happy to answer any questions that you may have about that. If you're wanting to know more about optimizing energy and protein, jump on and grab our guide. It will give you lots of tips, including some recipes and drinks that might be useful for you. Now, this next phase is interesting, and I'm going to ask you all, has anyone ever Googled how to stop hiccups? Now, I'm not sure if you can see this, but some really great advice here: to drink some water, do some weird things with your tongue, or to get a rectal massage. Likewise, if you were to Google dietitian, you will see that our wardrobe is made up entirely of white lab coats, and we live off a diet of green apples. So it's no surprise, given these strange themes that can come up, that if we were to Google diets to cure cancer, you also get some really interesting and potentially misleading results. And what's really important to know is that everybody eats. And because of that, everybody has an opinion about food and nutrition. And I want to make it very, very clear that there are no diets known to reproducibly cure or prevent cancer. And so if there is a diet that is promoted to you that is promising to prevent or cure cancer, it is not accurate. Importantly, we do need to eat well, but to promise of a cure is very misleading and can be quite dangerous, particularly because alternative diets, they can actually make things worse. They can be harmful to your health. They can make side effects more challenging, but they can also be quite demanding financially, socially, and mentally. So if it sounds too good to be true, firstly, it probably is, and always be skeptical and make sure you're asking an expert. You might have heard of some particular complementary therapies, of which there are many that have been promoted to be able to support you through cancer treatment or cancer care. And I've listed a few common ones here. Ginger is something that has been shown to be potentially beneficial in managing or settling nausea during chemotherapy. Vitamin D is a nutrient that's really important in upper GI cancers, but we only want to supplement it if your levels are low. So don't take a supplement until you've had your levels checked and you've been recommended to take a supplement. But do look into your vitamin D levels next time you get a blood test. Probiotics are quite common and becoming quite popular at the moment, but it's important to avoid probiotics if there's any neutropenia. So if you've got any low blood levels. And antioxidant supplements are also important to avoid if you're having radiotherapy. The moral of the story really when it comes to supplements is don't take anything until you've checked with your treating team, because there certainly are interactions that can happen that can make things worse rather than better. Where to go for more information? So certainly your treating hospital, your oncology dietitian within your treating hospital. I encourage you all to make sure you are linked in with your dietitian. The Pancare Support Line, the Cancer Council are there to support you. And important to know that the World Cancer Research Fund does recommend that everyone with a cancer diagnosis, past or present, does seek support from an oncology dietitian. And making sure you're accessing supports like chronic disease management plans for your GP to help make that more possible is very, very worthwhile. Now, these are my details. You're very welcome to reach out with any questions, concerns, or if we can support you in any way. We've got mailing lists, podcasts, information on our website, and I'd be delighted to hear from you and support you further as needed. But for now, we will take some of your questions, and apologies again for the strange tech issues.
That's okay, Lauren. Sometimes it just happens, but we rolled with it. So, look, we've got lots of your questions coming through the chat line. And look, thank you, Lauren, for taking us through that presentation. I hope you've all got something valuable out of it. We've had quite a lot of questions come through on Creon and Creon dosage, Lauren, and also alternatives to Creon, whether it's a different type that isn't pig related. So, hoping you can kind of answer some of those questions around dosage and all of that around Creon.
Yeah, for sure. What I'll do is I'll take you back to the dosage slide, and generally the recommendation is, and I don't know if I can click it, maybe I can't. The recommendation is that for every 6 to 8 grams of fat that we take in, we have about 10,000 international units of Creon. Now, you're likely to have been given one of two or both doses, either 25,000 international unit Creon or a 10,000 international unit Creon. However, for most people, a standard day would look like two 25,000 international unit Creons at each main meal and one at each snack. But it really does depend on the extent of your malabsorption. So I can't stress enough how important it is to discuss that with a dietitian to tailor it to your unique needs. The other really important part is timing, because they only last 20 minutes, making sure you're taking it at exactly the same time that you eat. First mouthful, Creon, is really, really key. And if you're having a long, lazy lunch, or if your meal's going to last more than 20 minutes, you will need to take a second one halfway through.
That's really good advice, Lauren. Where could people try and find more information around that dosage?
The dosage is very individual. So, I've got patients who need to take 5 25,000s at each meal compared to one. And so it really depends on your own symptoms. And getting feedback on your symptoms is important. So if you are noticing that your bowel actions are still pale, floating, or loose when you're on Creon, you need to review if you're taking it at the right time or if you're taking enough of it, because it's quite possible you'll need more.
Fantastic. Thanks, Lauren. We've also had another question come through one of our participants today, Irene, who's a carer for her mum, and her questions are around juicing. So she said that she's juicing as a meal supplement for her mother, and her oncologist has suggested that it may not be as helpful because they don't know what the side effects are with the chemo. So do you want to talk us through benefits of juicing? What might your recommendations be for someone who's going through chemotherapy treatment at the moment?
Certainly. Now, juicing is important to be aware of, particularly because you can end up having quite high loads of antioxidants coming through the system. Now, antioxidants are normally wonderful. They actually help to repair cell damage in the body. But when you're having radiation or some types of chemotherapy, we are actively trying to damage your cells. And so there is a theoretical risk that having high loads of antioxidants might actually block the impact of radiation and some chemos. And so juicing is important to be really mindful of, not to have too much. So my general rule of thumb is if you are juicing foods that you would be able to comfortably and reasonably eat, 1-2 carrots as opposed to 10 carrots or 2 cups of blueberries all in one juicing load. We want to make sure that we're eating juicing in a way that's reasonable. So the other thing when it comes to juicing is that you can end up displacing your food because you can fill up on liquid. You end up not meeting your nutritional needs because you fill up on fluids. So some recommendations when it comes to juicing would be actually prefer to blend rather than juice, because you end up with the flesh or the fibers related to the food as well. It's far harder to overdo the antioxidant load, but also I'd encourage you to make sure that what you're blending is high in energy and high in protein, and that might mean adding things like some Greek yogurt or some dairy products or a protein supplement, nutritional supplement powder that will bulk that liquid up so that it's far more meaningful than just the vitamins and minerals and the water.
Fantastic. Thanks, Lauren. Going back to Creon quickly, we've had another question come through from one of our participants who said, after having a pancreatic surgery a few years ago, is it necessary to continue taking Creon, a few years later when everything seems to be going well? What's the longitudinal aspect of taking Creon?
Yeah, if you've had a complete removal of your pancreas, then absolutely yes, you do need to continue taking Creon for the remainder of your life. And that's because you don't have a pancreas that's creating those enzymes. And even if you don't show signs of malabsorption of fat in your stools, you won't be absorbing those nutrients well. In particular, you won't be absorbing your fat-soluble vitamins, and you are likely to present with issues down the track. If you're someone who's had a partial pancreatic resection, so you've actually still got some pancreas left, that's a little bit of a different story, because there might be the case where your remaining pancreatic tissue actually gets better at doing its job, and you don't need as much or any Creon down the line if your body's able to adapt.
Okay. Now, one of the other questions that have come through is, at the start of your presentation, you mentioned some really valuable products that people might find useful for having a dry mouth or ulcers that are associated with having chemotherapy. Can you run us through some of those products that you mentioned again? There's one, I think, that starts with
V,
one
in particular.
Really interested in.
The Xyli melts, and I'll spell it for you. It's XYLIMELTS. Xyli melts. They're little discs that go under your lip, near your salivary glands, that actually help to stimulate your own saliva, which are proving to be more beneficial than artificial salivas themselves. So you might have heard of things like biotin and other artificial salivas that you actually use to lubricate your mouth. They work for maybe 10, 20 minutes and they keep you moist for a little while, where the Xyli melts have a little bit of a longer span of action. So they're certainly worth a try, and you can get some free samples online, I believe, and you can reach out to me. I can arrange those for you, because they can be really helpful when you're suffering from that dry mouth that doesn't sound so bad but is really debilitating.
Thanks, Lauren. Look, we know that time's almost coming to an end. It's 2:00, and we certainly didn't want to keep you online longer than you need to. And look, again, we're really sorry about the technical issue that we had before. There seems to be quite a theme around the Creon and the fatigue aspect of diet and nutrition with upper GI cancer. So look, what we'd love to do is actually have a good read through some of the question and answers that everyone's put forward today, and we can try and follow up with an email shortly, or put some information on our website or our social media pages that might just help address any of those other concerns that you have. But look, as Lauren said throughout her presentation as well, and it's what we'll talk about as well with PanCare, is it is important to kind of get the advice and opinion of an expert in this area. So please reach out to your care team if you've got any additional questions. But Lauren, we'd love to thank you for being with us here today and for sharing your insight and expertise on this issue. We'll follow up with everyone on how they can access some of the great information that you've provided on OnCore. But thank you for being with us today.
It's my pleasure. Thank you so much for coming. And as mentioned, apologies for the tech issues. If there are questions that need to be answered, please send them through to PanCare. It's such a wonderful resource, and we'll make sure that we get those all answered for you.
Thanks, Lauren. So look, what we did want to just run you through quickly, and it's what I did touch on before when our lines went down with Lauren, but just to introduce you to the patient and care team here at PanCare. So we do have Shannon and Sonia, who are a great resource for you to access if you're a patient or a carer and you're just needing that extra bit of help in coming to terms with the diagnosis or during active treatment or surgery, or just needing someone to understand and listen to you. So you can actually book a telehealth appointment with either Sonia or Shannon via our website at pancare.org.au, and they'd love to introduce you to anything that you need to help you away in your journey. As I also mentioned, we do have our online patient support groups which meet every month, and you're more than welcome to join us on those. You can contact Sonia at support@pancare.org.au for any more information that you have on how to join these groups. We'd love to see you there for our next one coming up in October. And also we have, slide is loading, our next webinar. So our next webinar coming up is going to be in November. We'll all let you know the date that that's happening, but our next webinar will be on symptoms and side effects of living with an upper GI cancer, and we're really fortunate to have two really well-known oncology nurses who will be presenting this topic to you. One of them is Christy Lee Jones, who works as an oncology nurse at the Epworth here in Melbourne, and the other is Shannon, who is our specialist upper GI nurse here at PanCare. So they would love to be able to take you through that. We'll certainly let you know the dates and times that that's coming up, but we certainly hope that would be of interest to you. So look, it's all we've got time for today. We're really glad that you're able to join us. We certainly hope that you got something out of it. As we said, it's our first time hosting one of these. We've certainly got lots to learn. So after the session today, you'll actually be provided with a quick survey that you can take, and we really would love to hear your feedback on what you thought of the content of the session, just so we can continually improve and provide you with content that is relevant to you and is going to help you on your journey. We're here for you, so please contact us if there's anything that you need from us on how we can support you. But please know, you're not alone. We're here for you. We'll get back to you on some of those other questions that have come up through today's chat. So keep an eye out on our social media pages, or follow up with Shannon and Sonia and the team at Pancare if there's any more help that we can provide to you. So from all of us here at Pancare, thank you. We're glad that you're with us, and we'll hope to see you soon. Take care.